Welcome back to part 2 of the Inpatient Data Elements tutorial. In this video, we will review the data elements in health metrics that are relevant to patients. The first data element is the patient admit source. This element will show sources of admissions such as, through a physician, or facility transfers. Knowing how patients are admitted can help with patient flow, patient satisfaction, and improve staff efficiency. The next data element shows detail patient age. This element displays the actual detail ages of patients. This can help hospital and health facilities determine what services tend to be associated with varying ages. Knowing ages can help with management and planning efforts. The next data element is a value-added field for age groups. Essentially, we are taking detail ages and putting them into groups for you. With this element, we have put the ages into 5 categories. This helps group them into popular standard age demographic ranges. The next data element is another age grouping value-added field. With this field, we have grouped age details into 20 groups that are 5 years apart. Again, these groupings are similar to standard demographic groupings and can help users that need more granular data. The next field is described as a condition code. This field shows if patients are admitted through the hospital emergency room. The objective here is to give you the ratio of those patients admitted through the emergency room compared to those that are not. This can help with managing flows of patients throughout your organization. The next data element shows the patient country. This element shows the patient's country of origin. Remember, you have the ability here to drill down into the data and find out why patients are utilizing the hospitals. The next data element is patient county. This will display the Florida county where the patient resides. These geographical regions can help you develop service areas and determine where to place satellite facilities. The next data element shows the patient county only this time through the Federal Information Processing Standards or FIPS codes. We incorporated the FIPS codes so that you can download this data and import it into your favorite mapping package. The next data element is the patient discharge status. This element can show you if the patient was discharged to home, or to a skilled nursing facility, or to another facility. Knowing how a patient is discharged can help you manage discharge planning and readmission issues. The next patient data element is patient emergency room arrival. This information can tell you what times patients arrived at the emergency room. This data can be instrumental in planning staff volumes, patient flow process, and determining peak volumes. The next data element is patient ethnicity. This data element essentially shows census data on those that are of Hispanic and Spanish culture as opposed to those that are not. You can see the codes and descriptions that are shown here. The next data element is the patient external injury. This element indicates if a patient had some kind of injury before arriving at the hospital. Examples might be a fall, or an automobile accident. This information can help determine expectations of accidental injuries occurring within a hospital. The next patient data element is patient gender. This element is obvious in that it distinguishes the ratio of males and females. The next data element shows patient payer mix. This element shows the primary payer of the patient. With this information, you can see volumes that utilized Medicare, commercial insurance, or Medicaid. This information can help with determining payer mix financial reimbursement. The next data element shows patient priority of admissions. When selected, this element can show admissions through the emergency room, admissions by elective surgery, and other admission descriptions shown here. The next data element shows the patient race. Studies show that racial and ethnic backgrounds may place patients at different risks for certain diseases. This element can help provide the highest quality of care for all patients. The next data element shows what state the patient resides. This element is straightforward as it will give the metrics on a state-by-state basis as shown in the descriptions. The next data element shows the weekday that have the most volume of patients. You can change time frames and filters to get a more precise weekday arrival. This element can help with staffing and workflow analysis. The next data element is the patient zip code. This element shows the zip code where the patient resides. This information can be used to form geographical primary and secondary service areas. It can also be used for analysis to place satellite facilities in high-volume areas. That concludes Part 2 of our introduction to the data elements available in health metrics. Please continue to Part 3 where we will go over those data elements related to practitioners, which include physicians. Thank you again for viewing our videos.